It's my pleasure this morning to share with you our story of introducing ECHO to Africa. As many of you know, Africa continues to face tremendous public health challenges. It shoulders the heaviest burden of the global HIV epidemic. In 2007, I had the privilege of moving to West Africa, to the Ivory Coast, to serve as the CDC country director. My primary focus in that role was helping the Ivorian government respond to the HIV epidemic. Also to help build the health system there and strengthen it. So what was that like? Well, it meant I spent a lot of time in meetings with global health development partners. At that time, the Ivory Coast was just emerging from a civil war. The UN had divided the country in two with a peacekeeping force. For years, the infrastructure had been deteriorating. The roads were terrible. It was really difficult logistically to get around. Occasionally, though, I was able to get out into the field and spend 3 to 5 days visiting clinics. This was actually the favorite part of my job, because I got to meet with doctors and nurses and hear from them directly what their challenges were, what their needs were. I also heard from them that many of them were seeing over 100 patients a day, and that they felt professionally isolated, and they didn't have very good access to up-to-date information. These encounters were absolutely fabulous, and I always came back to my office in Abidjan, the commercial capital, inspired. I wish, though, that I could have been meeting with these colleagues in the field much more frequently and more easily. I was usually only able to do this every 3 to 4 months. Right across from my office, which was on the campus of the University Teaching Hospital, was Professor Serge Holy, who's one of the world experts in HIV medicine. And I would often ask Serge if he would come along with us on these site visits. He was so busy, though, with his clinical duties and teaching responsibilities and helping write WHO international guidelines, that he could not take 3 to 5 days out to go into the field on these expeditions. I always thought it was incredibly sad that this amazing resource, this national local resource who was helping write global guidelines, could rarely go out and meet with some of his fellow countrymen in their local towns and villages across the country to share his amazing amount of knowledge and experience. In 2009, there was beginning a tremendous explosion in telecommunications technology across Africa. Maybe a little hard to see on this slide, but there's a satellite phone sitting to the left of my computer, and the computer has one of these new cellular modems plugged into the USB jack, and I was able to get on the internet. And this was just very new, but rapidly cell service was expanding across Africa. And we began to support some small experiments in creating email networks that could connect doctors and nurses in clinics like this that were 4 or 5 hours from the capital with experts at the university hospital. But these were very limited and fragile networks. In 2011, I first learned about Project ECHO when I read the New England Journal article about the New Mexico Hepatitis C ECHO project led by Sanjeev and Carla Thornton. And when I read that article, I was just totally excited that here might be a solution to this challenge of connecting people like Professor Holy at the university with the colleagues that I was able to go out and meet only couple times a year, and that this might create a network that could support a sustainable workforce development program. In 2014, stepping back, after 6 years of working in global health development, I came to the conclusion that education and capacity building were the most effective, cost-efficient, and sustainable interventions the US government could support in terms of foreign assistance. ECHO is an absolutely perfect fit for meeting these criteria. In 2014, I joined the ECHO team in Albuquerque, and a couple of weeks or a couple of months after I joined, I was in Atlanta for a meeting and had a chance to meet with one of my old mentors there, Ted Ellerbrock. Ted is the team lead for the Global AIDS Program Care and Treatment Team. And just a few months before that, the UNAIDS had announced an audacious goal to treat 90% of people living with HIV around the world. And the CDC, along with USAID and other partners, was part of the global effort to support reaching these goals. This was going to mean over a doubling in the number of people put on antiretroviral treatment. And this was going to require a massive scale-up in education and training across the world, particularly in Africa. I pitched to Ted the idea that maybe ECHO could be part of the solution to meet this challenge. Within about 2 minutes of talking to Ted, he immediately grasped the potential. And in his characteristically directive manner, he leaned forward and said, "You know, Bruce, this is a viral idea." Ted committed not only CDC financial resources, but also human resources from his team to help support a pilot of ECHO in Africa, and chose Namibia as the country where we would help do this. Within a couple of weeks, he had put together a consortium of partners. And within 2 months, we had a team on the ground in Namibia talking to the Ministry of Health and other key stakeholders. And what we found was everyone we talked to was excited about this idea, including Dr. Hamanume, who's the director of the National HIV Program. And at the end of the week, she generously invited us to share a meal at her family's farm in the north of the country. 1 year later, the first ECHO in Africa was born. What did we learn from this experience? We learned that, one, the IT infrastructure in Africa did not present an insurmountable obstacle. There were many challenges, but they were not insurmountable. And there was lots of creativity on the ground helping find solutions. Two, we found that there were local fabulous experts who wanted to democratize their knowledge and share it with their colleagues in the field. This is Dr. Tedesi, who is the chief clinical mentor for HIV in Namibia, sitting in the CDC office right down the hall from his office at the Ministry of Health. He was an absolutely fabulous clinical mentor, and to him, ECHO was a gift he'd been dreaming of that would allow him to connect with clinicians, doctors, nurses, community health workers all across the country. And the country was also creating a regional clinical mentoring program at that time, and this allowed him to connect with those clinical mentors and mentor them. And as a matter of fact, this is Dr. Bikanesi, who was one of the regional clinical mentors, and through participating in weekly ECHO sessions over the last 2 years, he became an absolutely amazing teacher and actually took over from Dr. Tedesi about 4 months ago. So this ECHO network not only was supporting doctors and nurses around the country, it was supporting the training of the next generation of mentors. As I said, over the last 2 years, we've had weekly sessions. 80 to 100 doctors and nurses have been participating every week. Over 50% of them are nurses. And at this point, we started with 10 pilot clinics, which served over 60,000 HIV patients across the country. That rapidly expanded to 20 clinics, and this year the goal is to expand to 40 clinics. So now I want to tell you about the next chapter in the ECHO story in Africa. 1 week after launching the Namibia ECHO program, I was in Cape Town at the International Union of TB and Respiratory Disease meeting, and I had a chance to meet with the director of the Kenya National TB Program, Dr. Massini. He had 2 big challenges that he wondered if ECHO might help with. One was they had a major problem with drug-resistant TB among Somali refugees in the Dodoma refugee camp on the Kenya-Somali border. He wondered he needed to be able to more easily access the doctors and nurses taking care of those patients to support them. He also had a problem with a recent decentralization of the health system and needed to maintain the quality of the national TB program in light of that. After he got back to Nairobi, he talked with his deputy director, Dr. Maureen Kameni, and he asked her to come to New Mexico for training the next month. When she got back to Nairobi, she approached USAID and the Global Fund for financial support. She was super excited about getting this ECHO program going. It was the middle of the fiscal year, though, and they had no available funding. She was not going to be slowed down, though, and she kept going with her plan to launch this ECHO within 4 months of coming to immersion training. The way that happened was she was willing to play the role of medical director, clinic coordinator, IT technician. She used her laptop to run the ECHO sessions from her office, and all the TB medical officers around Kenya participated from their tablets that they had been given to collect program data in the field. Luckily, these tablets had cameras and SIM cards installed. And as you can see here, this network is flourishing. The main lessons to me from the Kenya TB ECHO experience have been that when you have a local champion who is fired up, they can do anything. And they can also do it quickly when they're determined to do that. So what's coming next for ECHO in Africa? We're super excited about the next chapter. In 3 short years, 5 ECHO programs have started in Africa in 4 countries. There are over 20 in the pipeline, covering diverse disease areas from TB, HIV, laboratory systems, to autism, cancer, and palliative care. So what's next? This year, the Africa CDC was born in Addis Ababa at the African Union. This was a dream to create a public health institution that would strengthen public health across Africa. And they're in the initial stages of standing themselves up. They learned about Project ECHO and wanted to collaborate with us, and they're going to be using ECHO to engage public health leaders across Africa, across all the African Union member states, to support strengthening of international health regulation implementation. This is going to create a new paradigm for public health preparedness and emergency response. It's going to create connections across Africa in coordination and collaboration that never existed before. It is going to be transformational. Imagine if in 2014, during the Ebola epidemic, all the countries in Africa had been connected across ECHO networks. I think the response would have been much swifter, better coordinated. I think many fewer people would have died. Next month, we're going to be helping conduct the first echo immersion in Africa. And we're going to do it with some of our hub partners here in the US, and we're also going to be collaborating with some of our echo champions in Africa from the programs that are doing so well in Namibia and in Kenya. And related to that, I actually want to give a shout out right now to Doris Natori, who's in the audience. Doris has been the leader of the Kenya HIV Echo program, which is about to celebrate its first anniversary in a couple of months. And it's going to be leaders like her who are going to help with this spreading of echo in Africa, and already are. In Kenya right now, there are 5 or 6 echo programs in development. So as you can see, echo is rapidly spreading across Africa in all kinds of ways, helping connect experts and people who want to learn. This is just the beginning of the story in Africa, even though we've made a lot of progress over the last 3 years. I want to say also that in a month, the Ivory Coast is going to be launching its first HIV echo program. And our friend, Professor Serge Holy, is going to be serving on the expert hub panel for that echo. I think Ted Ellerbrock was right when he said, echo is a viral idea. Thank you.